Strike! Every single Nigerian should know what this word means. And if you attended public school, you have the unfortunate added advantage of understanding it more. It has always been a debate as to whether or not healthcare workers should go on strike. But then again, if every other sector of public service is allowed the privilege of the mandatory holiday that has proven over the years to be a language our government really understands, then why not the healthcare sector too? Stay with me, as I will be sharing shortly with you what some nurses did during a strike that led to the death of an innocent young boy. As you know, there are 200 million stories unfolding every single day in this country. Bold Stories reveals them and the bold voices behind them. My name is Antonietta Kaulunta, and you're watching Bold Stories. Very recently, resident doctors in the Nigerian public hospitals threatened to go on strike in order to demand better benefits and also provision of more protective clothing as they battle the coronavirus. Strikes are common in Nigeria's public health system, with practitioners deeming this their best bet to seek pay rises and improvements of underfunded infrastructures. Today's story was posted publicly on Twitter by a tweep in a not yet deleted post as of the time of this shoot. He narrated that a 7-year-old boy traveling with his parents had a fatal accident in which the parents died. Instantly, the boy had what he referred to as bilateral femoral fracture, I believe, and was brought to the accident and emergency ward. They resuscitated the boy, but were handicapped as the Joint Health Sector Union was on strike. He donated a pint of blood instantly as he had the same blood group as the young boy. Sadly, they couldn't take him to the theater because it had been locked up by nurses who were on strike. Before the person in charge of him had gone to pray to return, the little boy had died. Again, another unfortunate incident that could have been prevented if only our system operated better. If only people made better decisions. If only. To explain to us from a medical perspective the stand of healthcare workers on this particular topic is a medical practitioner. Let's hear him out.
I'm by name Dr. Shoaib Joga. A resident doctor from Department of Internal Medicine, Ahmadu Bello University Teaching Hospital. For a child that sustained bilateral femoral fracture and has a very promising picture, and now has to be rushed to the hospital, then he couldn't secure medical intervention because of strike. Places are being closed. The theater that is supposed to be operated are being closed. I felt very bad about that, and I felt it's something that is avoidable. Now, for me to answer this question, let's see what are some of the reasons why doctors go on strike. Now, there are many reasons why doctors go on strike. One of them is because of the poor healthcare system in the country. Number two is because of the poor policies. Like, for example, ideally, based on the WHO standards, a healthcare ministry is supposed to get like 50% of the budget, not less than 50% of the annual budget. But like in Nigeria, we receive less than 5% of the budget goes to the health system. And number three is the issues of upgrading of the healthcare institutions. Now, if you just go across the country, the primary healthcare system and the tertiary healthcare system, we can see that the standards of the infrastructures and also the equipment, they are very poor. So I feel like it's one of the reasons why doctors go on strike. Now, we've been bound by the laws of federal government regulations and also by Labour Congress. So as part of workers, I feel like it's okay if we want a certain things to change to go for strike. Now, let's look at the ethical consideration. I want to read a statement by, they call it camp formulation, which says that always treat others as having individual moral worth, dignity, not as a means to the end. What it means, like, as a doctors and other healthcare professions, we have to, our priority is take care of our patients and not to see them as a means to an end. And now let's also check about the Hippocratic Oath, which is a code of ethics that bind all doctors across the country and even globally, which says that any patient that presents to emergency, he is obliged to be treated and to be seen. So that means we should not try to send away any patient that comes on emergencies and all that. And I don't feel like doctors do that differently, because okay, Nigerian Association of Resident Doctors, which is abbreviated as NAT, did a strike last 6 weeks, and like most centers, we see like the emergencies are open, then even the COVID team that are responsible for the pandemic, they are also open, so that at least we take care of the emergencies, and so that we can go away from the Hippocratic Oath, the oath we swear after we've been inducted. Yeah, for whether it's the hospital or the doctor to be indicted because of what happened in the incident and all that, I feel like they are only following what is necessary and all that. They're trying to see that they improve the healthcare system so that will be good for our children and and the next generation too and all that. So is there any way that doctors will go for strike apart from that doctor will try to get their needs met apart from going on strike? And I was actually part of the Nigerian Association of Resident Doctors. I do follow even when we start to go on strikes. One of the first things they did is to tell the government this is what we want to be improved and all that. Yeah. Then secondly, if the government refuse, they try to lobby maybe from the National Assembly and all that in every possible means. Now, if it fails, then they give a warning strike. Now, if the government didn't hit to the warning strike, then that is where we go further to see that we embark on strike. So I feel like there is a diplomatic way by which we approach to make our need. It's just that our country, Nigeria, they don't understand any language apart from strike. So that is why I think strike in Nigeria is sometimes a necessity. We call it a doctrine of necessity to see that we were able to achieve some of the decaying system in the country. Now, for the things to do to prevent strike and all that, I feel like the governments should try to improve the healthcare system in the country, and also they should try to amend the policies from the nurse so that at least they should consider a lot pertaining healthcare system, and I believe that also the life and safety of doctors too shall be protected, more especially on this pandemic of COVID-19. I feel like government should do a lot way to see that they improve the working conditions and the standard of doctors in the country. So that is just little I have to say. Thank you very much.
Brilliant narrative from the guest today. Thank you very much, Doc, for coming on board. There are many negative consequences of healthcare workers going on strike. Top of the list, which is the loss of lives. As much as we would like to clamor for health workers to never strike again, we must ensure that there are other alternatives for them to make demands for increased remuneration, better infrastructure, and the lot. Because as things stand, we can anticipate that in the near future, there will be another threat of strike, or an actual strike, for more wage and infrastructure bargain. This only means we can anticipate that more innocent Nigerians will die, by no fault of theirs. Nigeria can do better. Thank you for watching today's episode on Bold Stories. Don't forget to tell us what you think by hitting us up on social media. You can also let your voice be heard by featuring your story. Simply send us a message on social media or post your story using the hashtag BoldStories. My name is Anthonyetta Kalunta. See you next week.